Hello, thank you for joining us. Thank you for your interest in the field of child life. I'm joining you here in my office in the Pediatric Specialty Clinic at the University of Iowa Children's Hospital. So you can see behind me, it's just full of toys and activities that we use with patients when they're here for their hospital visit. So I'm going to start my PowerPoint for you. So my name is Emily Baxter. I'm the Child Life Programming Specialist here at University of Iowa Stead Family Children's Hospital. Here's a little bit of my background. I grew up in Iowa. I went to Samford University, which is in Birmingham, Alabama, and received my bachelor's in family studies with a child life concentration. I started my career here at the University of Iowa Stead Family Children's Hospital in 2007. And then later went on to complete my master's in educational psychology in 2010. So what is a child life specialist? When I started my college career, I was a nursing major. I knew I wanted to work in healthcare and work with children, but it wasn't until the summer after my sophomore year that I heard about child life, and I immediately knew that this was the profession for me. Although I wanted to help kids with medical procedures and hospitalizations, I didn't really want to be the one figuring out all the math and science for the dosages. I didn't want to be the one that was actually inflicting the pain for shots. I wanted to be that safe person who helps them through those difficult situations. I love my job. I love helping children and their families learn to cope and navigate their hospitalization. So as a child life specialist, my focus is on the patient and his or her family. My goal is to address the psychosocial aspects of hospitalization. I use play as a way to communicate with children to make the hospital less strange and less frightening. So to be a child life specialist, there's a couple steps that you need to go through. Many universities have specific child life programs. The University of Iowa, for instance, has a degree in therapeutic recreation with a child life emphasis. So to become a certified child life specialist, you must have a bachelor's degree in child life or in a field related to child development. It's also important to have volunteer hours as well as a practicum experience. So once you have that bachelor's, you will complete a 600-hour child life internship and then take the national certification exam to become a certified child life specialist. So what do we do in the hospital? So being in the hospital is very abnormal for kids. My job as a child life specialist is to provide activities that make the hospital more normal and less scary. I do this with simple things like providing crafts, games, and other activities. The hospital can also seem very isolating. Outside of the hospital, children have many opportunities to play and interact with other children. Prior to having the restrictions in place due to COVID-19, we held daily group activities here at the hospital where patients could interact with other patients in a playroom setting. Now that we've had these restrictions in place, we've had to be really creative. We've utilized a lot of technology like Zoom, and also the picture there shows a driver-operated robot that we've recently obtained. So we can use these different virtual experiences to increase socialization while the kids are here. So it's also important to promote normal development. This is particularly critical for infants during extended hospitalizations. So again, we try to provide opportunities for normal play, even though a baby may be constrained to a hospital bed. And finally, it's important to celebrate milestones while in the hospital, a birthday, a holiday, or when a child completes a lengthy treatment. We like to celebrate with presents, balloons, anything to make this a special experience for them. So why do I keep talking about play? Why is play so important? Play comes natural for children. You don't have to tell a child how to play. If you put a clump of Play-Doh in front of a child, they're not going to say, well, what do I do with it? It's just natural for them to take that and make it into something. So we want to incorporate that natural form of play into the hospital to maintain a normal environment. may look like we're just playing, but there really is a rhyme and reason behind everything we do. We have a very strong background in child development, meaning that the activities that we choose are catered for that child's specific developmental needs. Play is essential. It's, like I said, it's natural. It's a natural part of childhood. Play facilitates healing, coping, mastery, self-expression, creativity, achievement, and learning. It's vital to the child's optimal growth and development. It's an integral aspect of the child life practice with infants, children, teenagers, youth of all ages. And this is just one of my favorite quotes here. Through play, a child grows, develops, expresses his emotions, and adjusts to his environment. Ill or well, the child needs play. Another part of our job is to prepare children for hospitalization, for medical procedures, and for surgical procedures. So even if I only have a few minutes to talk to a child before they go into a procedure, it's important that I take the time to tell the child what he or she can expect. A lot of times I'll tell the patient what other kids have told me about a particular procedure. For instance, I might tell them, well, this first part, other kids have told me that it feels like a sting, but it only lasts for about 10 seconds. So let's count together. Let's count 1 through 10. And then by the time we get to 10, that stinging part will be over. So it's important to be honest with patients. Part of my job is to build that rapport so that they know they can trust me. Medical play is a type of preparation, but it's one of my favorite things to do. Essentially, this is playing doctor. We use real medical equipment to help kids explore and ask questions. This also provides us with a way to clear up any misconceptions. We often talk about what the procedure is that the child has endured, or maybe a procedure that they're going to endure. And then we choose that procedure to perform it on a doll or a stuffed animal, or the first picture there it's a little chemo duck that they're performing a procedure on. In the middle picture, that's actually a blank doll surgery that we did. This little guy had a cardiac device implanted, and once he recovered enough from that surgery, we decided that it was best if his doll had a similar device so that they looked the same. So we used real medical equipment. We used a real scalpel to make the incision. We do a lot of hand over hand to help maintain safety while we're doing medical play, but to really give a lot of control to the child. Medical play is very much child directed. Once they're free to play, it's amazing what kind of things they can come up with. So we try not to put too many restrictions on it. So we're going to watch a little video here. This video is really good for showing what a child life specialist actually does. So this shows some real life medical procedures and the distraction that a child life specialist uses.
Sometimes children need to have medical tests or treatments that may hurt, such as getting an injection, having blood drawn, or a catheter placed. We know from decades of research and clinical experience that providing intentional and skilled distraction can help children cope through procedures and feel less pain. Successful use of distraction is a skill that is learned and improved through practice. This short video will help you learn the key elements of distraction coaching and teach you how to use this simple yet effective intervention with children. The key elements to providing effective distraction coaching to children are: make a plan that includes the child and family, establish your role as distraction coach, respond to the child's cues, and stay focused on being an effective distraction coach. Make a plan. Before the procedure starts, make a plan that includes pain prevention strategies, comfort positioning, and distraction. Start by asking the parent and child what worked best during previous procedures for reducing pain and anxiety. Determine the best form of analgesia for the procedure, such as numbing agents or commercial projects that use cold and vibrations to interfere with pain sensations. Some of these therapies require time to take effect, so it's important to plan ahead and let everyone on the team know the time frame. If possible, have the child positioned upright for the procedure. A parent or other trusted person may assist with comfort positioning and provide a supportive presence for the child. Then plan your distraction strategy. Include the parent and child in selecting a few novel and engaging items or things to do. Choose items that are consistent with the child's developmental and functional abilities. For infants and toddlers, use singing or sounds, rhythmic gentle rocking or patting, or sensory toys that light up or vibrate. Toddlers might like engaging songs like Wheels on the Bus or books that make noises. For preschool children, choose distractors that involve the child in physical activity, such as blowing or popping bubbles, action books, and finger play games. Breathing games using a pinwheel or pretending to blow up an imaginary balloon are good to help young children relax. For school-age children, silly toys, seek and find books, and novelty toys can keep their attention. They might like to be involved in guessing games, such as 20 questions. School-age children can usually follow your instructions on deep breathing to help reduce distress. For teenagers, involve them in conversations about pets, sports, or books that bring up pleasant memories or calming images. For teens who don't want to converse, a squeeze ball or listening to their preferred music can be distracting. Older children may want to select their own distraction techniques, but may require prompting to focus on distraction during the procedure. Finally, developmentally appropriate interactive video games or apps on a tablet or smartphone are specifically designed to capture and hold a child's attention. They can be used to engage toddlers to teenagers. Plan to have at least 3 distraction items or activities that you could use during the procedure. For children who have difficulty maintaining attention, have a few additional items to use if needed. Make sure you have ready access to the items before the procedure begins, and place some distraction items out of the child's sight so that you can introduce something new if you lose the child's attention. Part of your planning should include asking the child if they would rather look away from the procedure or watch. If the child wants to look away, block the sight of the procedure by placing a book or tablet in the child's line of view. For children who want to watch, plan on offering quick peeks and then redirect the child back to distraction. Note that the child's preference to look might change during the procedure, and adjust your coaching as needed. Establish your role as distraction coach. It's very important that you, as the designated distraction coach, are the one voice that the child hears during the procedure. Introduce yourself as the child's distraction coach and tell everyone in the room that you will be engaging the child's attention throughout the procedure. All medical personnel and family members need to support your role in capturing and maintaining the child's attention. It may be necessary to ask non-essential staff to step out of the room. Ensure the environment is calm before the procedure starts so that the child stays focused. Close the door. If the TV is not intentionally being used for distraction, turn it off. Ask everyone in the room to limit side conversations. When you're ready, make sure that you are positioned so that you can make eye contact with the child. Use the child's name to ensure they're listening, then give direction. Have the child practice any breathing techniques that you might want to use. Begin to engage the child in distraction before the procedure begins. Respond to the child's cues. During the procedure, be continually aware of when the distraction is working and when the child's attention has been lost. If you feel the child's attention drifting from the distraction, direct the child to take some deep breaths to refocus attention, and then try another distraction item. Use clear directions guiding the child to engage with the distraction item. Try to vary the tone of your voice. A soothing voice can be used to calm the child. An energetic tone can be used to recapture attention. Distraction can help reduce the amount of distress the child feels, but it doesn't block out all of the uncomfortable sensations or pain. Children need to express their feelings, be accepting if the child cries. A child who is upset may be able to follow a specific instruction, such as squeezing a parent's hand or a soft toy when prompted. If the child is able to pay attention to you and respond to your requests, then the child is benefiting from distraction. Distraction can be helpful for almost all children, especially when it's individualized to the child's specific development and needs. Consider things such as their previous experience during procedures and diagnoses such as autism, attention deficit, or developmental delay. Keep in mind that children of any age may have difficulty coping. Stay focused on being an effective distraction coach. Staying focused on distraction can be difficult for the coach as well as the child. Maintain a concentrated effort to engage the child. This seems intuitive, but it takes skill and practice. Your only job as the designated coach is to help the child remain calm and engaged in distraction during the procedure. At critical points in the procedure, such as when a needle is inserted, the child may lose focus. It's hard to see a child in distress. You may feel the urge to reassure and tell the child that everything will be okay. But research shows that reassurance often upsets the child and escalates distress behaviors. Instead, provide specific instructions to the child, such as, "It's really important for you to hold your arm still right now," or "Squeeze my hand as hard as you can," or "Breathe in through your nose as deep as you can." Keep working with the child and introduce other distraction items when you've recaptured the child's attention until the procedure is completely done. Stay calm and confident. Remember to praise positive behaviors like trying to hold still or paying attention to a distraction strategy. Although medical procedures for children may be unavoidable, distraction coaching reduces pain, anxiety, and distress, as well as teaching children coping strategies. Children and their families will benefit from your commitment to learning and practicing distraction strategies.
Definitely distraction is necessary in order to perform procedures successfully and help the child relax, because often these kids have to come back time and again. And the last thing we want is for them to dread coming to the hospital. So it makes all the difference in the world.
I thought today we haven't had that done before with the distraction, and it just helped take her mind off of it. She didn't seem so anxious. There wasn't a tear shed. It was very, very smooth.
I love being able to walk into a room and change the outlook. So walk into a room where the child could be anxious or they've had a traumatic experience, and I love being able to use my tools and use my coping techniques to turn that around so that it's a positive experience and not negative.
I use some of my coworkers to blow bubbles. I want them to chit chat. I need them to do a lot of distractions, because whoever has the needle, that's the one who needs to focus on the blood sample. So what I'll do is use teamwork to help me do distraction for each child if needed.
I always like to start, especially with the younger age, I like to start with those bubbles and spinner toys because it grasps their attention. Even as they're walking into the room, I'll start blowing bubbles so that they can see that I'm a fun person. I'm not gonna do anything that hurts.
I would advocate for giving kids jobs. So asking them, giving them control, making sure they know what their jobs are, holding still and breathing, or whatever you need them to do in order to cooperate for the procedure, and then allowing them to choose whatever play intervention they want. Do they want to look at a book? Do they want to blow bubbles? And trying to engage them before playing, during play, or during the procedure, and then playing after.
So there's a couple strategies that I use to help a child have a successful procedure. When I enter the room, I always address the child first. I get down so that I'm looking the child in the eyes and explain that I'm there to help. It's important to offer choices so kids feel a sense of control. I can't offer them a choice between taking their medicine or not taking it. But I can, however, offer them a choice between taking it through a syringe or taking it in a cup. It's important to be honest with kids. So I've certainly had children ask me, will this hurt? So instead of saying no, not at all, I would reply with, well, some kids tell me it feels like a pinch, or using descriptive words that they can relate to. And every child is different and every child copes differently. So being able to adjust my distraction and my coping techniques that I use is really important. We also promote positioning for comfort. If a child was made to lie on a bed during an IV stick, he or she would likely be frightened. So putting the child in an upright position gives him or her more control. As you can see, the top picture shows the child sitting in the father's lap with her arm out of the view. So the nurse is the one in the gray shirt there performing the IV placement. And then in the purple shirt with the iPad is the child life specialist offering some distraction. The picture on the bottom left has the child facing out so she can see the procedure. At times, there are children who like to watch. They like to watch the poke. It gives them a little more control. But this offers the child, offers them a choice to watch the poke, but also to distract by looking at the Dora book that they've got there. Words are very important. So although although saying good boy or good girl may seem helpful, it's best that we use phrases that reinforce what the child is doing right. So things like, good job holding still. Great work at blowing those bubbles. You were really brave today at helping us. So finding the behavior that the child did well and praising that specific behavior is going to enforce that they continue to do those behaviors that we want to see. Lastly, there are many areas outside of a children's hospital that child life specialists work. This list gives you some examples, and there's some links here that you can later research to get more information. As you'll see, there's things everywhere from hospice, the school system, early intervention, camp settings, private practice. There's some different private practices that use play therapy to help children. Nonprofit organizations, dental and mental health, child advocacy, rehabilitation, and then different areas that are child life disaster relief and Operation Smile. Those are two areas that child life specialists go out of their local area to help in times of need. So thank you for your interest in the field of child life, and I look forward to more child life specialists in and around the area.